We are at Columbia University today. As of now, New York City have lifted all COVID restrictions throughout the tri-state area, and Columbia University helped a great deal to achieve this milestone. We have a very special guest today. She's a professor and she works with Columbia University ICAP, Harlem Prevention Center. She's Susan Strasser, a nurse. Tell us about how pandemic preparedness program, how it helped our city.
Well, first of all, thank you for allowing me to speak about the work that Columbia has been involved in as the director of ICAP, Michaels-Strasser, the CDC, a Center for Disease Control, and the state to figure out what steps do we take, first and foremost, to save lives and reduce infections, and eventually to get to where we are now, where we do have a vaccine which is effective and have a ability with a critical mass of people vaccinated and lower infection in New York to be able to get back to some level of normalcy. Although obviously I still have my mask. We knew that we wanted to keep other operations going, even at a time when the hospitals were very stretched. So we're very involved in developing guidelines for how to do that safely, how to keep Columbia safe. And the biggest thing, two things that we were involved in, first was developing a contact tracing program in partnership with New York City, a group of about 20 contact tracers and supervisors to run this program in conjunction with and in addition to what the city was doing. The city was really very, very busy in those first months, and we wanted to be able to make sure that this community was as safe as possible, and we were learning and adding to what the city was doing, so we set up this contact tracing program.
There was a system that when you should take the COVID test, like how many days, and Columbia created a app.
Right.
To get a green pass.
Right.
So how did you came up to that?
So the system, we knew that there needed to be something that was practical, user-friendly, but also gave real-time information. So an app was the way to go to be able to connect the dots of the infection with people. And that's really what infectious disease management is all about, is connecting the dots of who's infected and who they've interacted with. That's what the principle is behind contact tracing, to break that chain of infection. So this app allows, I use it every day. It's a symptom screen, and it asks whether you have symptoms of COVID, whether you've been knowingly in the proximity of someone with symptoms or with COVID, and then you have to attest. It's an attestation to say no. And then once you hit that no button, a green pass comes up. And then that allows you to access the university. If someone hasn't done that, then they get a red pass and they won't be allowed to enter into the facilities. And so even though within facilities at the entire university, we still maintained social distancing and wearing masks to this day. Inside we wear masks. It was a way to help ensure that our community was as safe as possible. Really a gold standard that we would want to be able to have everywhere to keep people safe. And the infection rate remained very low amongst the community. With contact tracing, one of the things that was very important was the testing. As I said, Dr. Melanie Burnitz and Wafa El-Sadr worked together to develop this very robust testing program. And we had what is called gateway testing, which allowed people to come back to work, but only after they were tested. And then now we routinely get tested. Like it's like a lottery. You get chosen to get tested periodically. And so this past week I was tested again.
Let's talk about some of the research that ICAP, have been doing in like Harlem. That one of them I was involved in, taking participant and getting tested for them, both antibody test and a COVID test and asking some questionnaire about how to get data for NIH.
Right.
And they were giving them a gift card worth of $50, which helped a lot of people in the community, because I saw some of the people came up to me and say, look what I bought with my $50. So tell us about some of these initiatives that ICAP did and Columbia University did to help the community.
So ICAP is a global institute within the university, and we primarily have two areas of work, really building on 15 years of work in HIV. And during the 2014 to 2016 Ebola outbreak, we also became engaged in that work. And historically, HIV, TB, malaria, we've been involved in infectious disease control and management. And in addition to the work that we do internationally in over 20 countries, we have a program in Harlem and the Bronx that is largely supported by the National Institutes of Health, NIH, for various studies. And ICAP received funding for a variety of studies, both at Harlem, as you discussed, and in the Bronx. And the studies, there were a few different studies around monoclonal antibodies, so looking at some of the potential treatments, but also vaccine research to look at what is safe and effective to give.
That is excellent, and that in a way helped the community to lift them up, correct? Because a lot of them lost their job or businesses, so it's a way to, I feel like, bring the community together and help them.
Exactly, and I think for all of us, even us who work in this all the time, and this is what I've always done, is infectious disease, since I became a nurse and later as I moved into public health. But you need hope, and it was very hard in those early days because there was so much uncertainty.
Yes.
And I think for us and for the community to show that we're doing something and we're trying and we're learning and we're going to figure this out. I remember I did an interview for a news channel early on and saying this is very difficult right now, but we will get ahead of this. And I think there has been a lot gained over this last year in knowledge, but also in our ability to bring people together to mount an effective response. I think we still have a long way to go before we're really through this. As you said, we have lifted restrictions here, but still walking very cautiously with the testing going on, with the use of masks indoors, and as you said, getting everybody here at Columbia vaccinated. There are some exemptions, but they're quite rare, and that really is a testament to our belief as an academic institution in science, and also in the ability of these vaccines to truly help people survive and to not become critically ill.
Thank you, Susan, for joining us today, and we will look forward to what you bring in the future, and excited to hear more about the REACH program in future also. Thank you for joining us today. It's very hot in New York City, but we had a great conversation.
Great. Thank you so much.
Thank you. I'm Nishat Mirza from Turkish Journal.